I am here to describe the spinal cord. The definition of spinal cord: the spinal cord is flat nerve that extends from the nuclear nervous system of the brain and converges and is fortified by the spine. The main function of the spinal cord is the transport of stimulus production between the periphery and the brain. Another function of the spinal cord is the regulate spontaneous movement, including spontaneous movement of the eyes, nose, and other. The spinal cord is covered by the Manning's membrane. When viewed horizontal, the outer spinal cord looks white and the inside is gray butterfly. The white parts store many nutrients which were put in myelin. This part is to displace the impulses leading to the brain and from the brain to the effector. The gray part stores nerve fibers without myelin. The section is divided into two, namely the dorsal base of the posterior base and the ventral or anterior base. The dorsal base stores sensory neurons and the ventral base stores motor neurons. Spinal cord section. Spinal cord or spinal cord is a cylindrical set of nerves that depart from the lower part of the brain and then traverses the spinal canal. The spinal cord is divided into several slices. Each slice has a nerve base, a ligament on the right and left. The base of the form nerves on the base of the area nerves work as motor, while the base of the back nerves of the base of the area work as sensory. The incisions in the spinal cord are categorized into several zones. In order from top to bottom as follows. 1. The neck consists of 8 nerve bases. 2. The chest consists of 12 nerve bases. 3. The stomach consists of 5 nerve bases. 4. The pelvis consists of 5 nerve bases. 5. The coccyx consists of 1 nerve base. From each layer of zone, nerve fibers will extend to certain part of the body and certain seal in the same direction as the layer. For example, the thoracic nerve is used to supply the chest, skin, respiratory tract, and seal in it. The composition of the spine. Here below are several spinal arrangements including neck vertebrae, cervical vertebrae. There are 7 vertebrae in the neck, with the first vertebrae being the atlas. The atlas bone serves to support the skull. The second vertebrae in the rotating bone axis. The presence of the atlas and axis bone allow the head to retort the thread to the 7 segment has a similar shape and does not have joined with the ribs. Vertebrae. Thoracic vertebrae. The backbone consists is 12 segments with almost the same shape. Each vertebrae a body of bones with bony protrusion to the left and right as a joint with ribs. This bony body is attached to the earth of the vertebrae, which provides the spinal cord. Between the vertebrae there is cartilage. Lumbar vertebrae. Lumbar vertebrae number 5 vertebrae. The lumbar vertebrae is short and large vertebrae compared to other vertebrae. The shape is almost similar to the vertebrae, but does not have joint with the ribs. The segment of the groin. Sacrum. The sacrum is a combination of 5 bone segments that they are united. This bone has the joint of the pelvic bracelet, the last vertebrae, and the coccyx. Thigh bone segment. Coccyx. The thigh bone is the vertebrae. The coccyx coccyx is a combination of 4 bone segments that they are united. This bone is joined with the collarbone. Spinal marrow function. The following are some of the functions of the spinal cord, namely as follows: 1. Connecting impulses from the senses to the brain. 2. Connecting impulses from the brain to the senses. 3. Connecting the brain with all bodies. 4. Become the core of spontaneous motion and provide freedom of passage of spontaneous motion at a glance. Spinal deformations. Deformations of the spine can occur due to improper sitting patterns. Some the cause. Kyphosis is a form of the spine curving left or right. Kyphosis is a form of the spine curving back. Lordosis is a form of the spine that curves forward. Injury and disorders that are in marrow. Some of the things that cause injuries to the spinal cord include violence such as being stabbed or shot, dive into shallow water and hit the bottom, trauma during an accident, fall from a significant height, injury to the head and back during sport, electric shock. Apart from injury, a person can also suffer from spinal cord disease. They are the condition that cause is to the break, such as tumor within the spinal canal can be carious and non-carious. Spinal stenosis, narrowing of the vertebrae, usually occurs due to aging. Necklace pulsus hernia, the displacement of the vertebrae of the spine put pressure on the nerves. Abscess, the appearance of a collection of pus due to infection so that an inverse with the performance of the nervous system. Hematoma can occur due a heart impact resulting in bleeding that requires emergency help. Vertebral puncture, spinal puncture or fracture, usually associated with injury or trauma. Degenerative disc disease, gradual aging that occur in disorders including in the spine. Symptoms that appear differ on the type of disease suffered. Some feel it gradually. Some are direct and most immediately get emergency treatment.